Could the health care bill create new opportunities for unions and perhaps new headaches for patients?
Our next guest says that's exactly what could happen. In today's Wall Street Journal, he pointed to a cautionary tale involving a notorious political figure, former Illinois Governor Rod Blagojevich.
Mark Mix, the president of the National Right to Work Legal Defense Foundation, is here to explain the connection. So go ahead, Mark, explain.
Well, it's good to be with you, David and Liz. Thanks for having me on. This bill, the National Right to Work Organization wouldn't have a dog in this fight, if you will, with all due respect to Michael Vick. But when we started looking at the bill, we analyzed that the over 1,000 pages, we found both overt, some really subtle, but some overt, basically gifts to organized labor and what will help them organize more workers and get more workers to pay dues as a condition of employment. And we found a great example from Illinois back in 2005 with Governor Blagojevich, who signed an executive order basically signing 75,000 home health care workers over to the Service Employees International Union, and that's Andy Stern. And Andy Stern is a big advisor to the president on this bill.
Okay, but what is the union connection here, Mr. Mix? Because, you know, we know that there are positives and negatives to unions, so let's be really specific here so that we're fair.
Well, absolutely. First and foremost, in Section 164 of the bill, there is a $10 billion bailout for organized labor and unionized health plans. Basically, if you're an employee association running an insolvent health care plan, you can participate in over $10 billion that will be set aside in a reinsurance program that will go out to bail out these insolvent health care programs that unions are running. One eligible organization is the Voluntary Employee Benefits Association, which they tried to do with GM and Chrysler prior to the bankruptcy of both of those organizations. So there's $10 billion in tax money. There's also specific penalties for non-unionized companies in the bill that don't provide health care up to the public option standard. And yet in all of the bills, House Bill 3200 and the Baucus bill that still remains to be seen, there are provisions that would penalize non-union employers up to $20,000 per employee, but interestingly enough, unionized health plans that are bargained through the bargaining process would be exempt from these particular penalties. And what this means is union organizers can go to an employer and say, hey, you know, your plan doesn't live up to the standards, you may have to pay a penalty. If you'll just unionize your employees, we can get together and we can negotiate a plan that will be exempt from the public option. So those are just two things in our minds that will lead to, and have historically led to, an expansion of union power over these employees.
All right, well, you mentioned that's the Baucus plan in particular. God knows if that's going to end up anywhere except on the drawing room floor. But the fact is that there's going to be a lot of discretionary power for all of the secretaries, particularly the Secretary of HHS, in this case Kathleen Sebelius, in order to direct projects to where she wants them to be directed, correct? There will be a lot of discretionary spending by the head of HHS.
Yeah, that's right. There will be a job training program that will be run by that particular agency. And basically, all the job training money that will be in this bill for healthcare professionals will have to be given out to organizations that are run with unions at the head. They have to be cooperatively run, but they have to be involved. Labor unions have to be involved. And so a non-union or a non-affiliated apprenticeship or training program in the healthcare industry wouldn't be eligible for these funds. So that's another big payout. And the Secretary does have dramatic discretion. There are several panels and boards that are set up. Many of them require that a representative of organized labor get a seat. And so, yeah, it's a bill that's got lots of little things and some really big things.
Let me go to the basic, most fundamental issue here of getting health insurance for the 40+ million people out there who don't have it. Does your organization want to just blow this off and not have it done at all because it's just too tough, or is there some type of idea that you have that could make it happen?
No, Liz, we don't have any comment on underlying health care reform. What we do believe is the bill doesn't need and shouldn't have special privileges for organized labor to expand their power over health care professionals and workers that may end up in this program, however it passes. You know, I don't have a plan for that. Our organization doesn't. We're concerned with compulsory unionism and how public policy is used to expand that power. And without these provisions in it, I don't have anything to say about the bill.
Mark Mix, president of the National Right to Work Committee. Good to see you, Mark. Thanks.